Navigating an unexpected diagnosis is daunting enough. The challenges of health insurance denials and appeals can make it even more difficult. In some cases, patients aren't able to get the life-saving treatment they need.
A shocking moment that instantly gripped our nation. Brian Thompson gunned down on the streets of Midtown Manhattan. The targeted killing of United Healthcare CEO struck a nerve on social media.
Unfortunately, sympathy requires a prior authorization, and I have to deny that request.
But people are tired. They're tired of corporate greed. They're tired of CEOs making millions of dollars while their family members are not being taken care of properly.
On X, one man said medication prescribed by his wife's oncologist to treat her breast cancer was denied. In another post, a father shared a letter from United Healthcare denying a wheelchair for his son with cerebral palsy.
This isn't just about big CEOs needing to do something differently. It's also about our elected officials recognizing that applying Band-Aids to this isn't going to cut it for much longer.
Caitlin Donovan works for the Patient Advocate Foundation, a nonprofit that provides case management and financial assistance to patients diagnosed with chronic illnesses.
And people get very, very frustrated because what they're experiencing is it takes me 10 calls to get the insurance to cover something that my doctor prescribed and is telling me might save my life.
The insurance industry calls it prior authorization. It's not enough for your doctor to prescribe treatment. The insurer has to agree to pay for it. Nearly all doctors surveyed by the American Medical Association said that prior authorization requirements have delayed access to necessary care. 1 in 4 said prior authorization led to a serious or life-threatening medical issue.
People need help. Everything is too expensive. The system is way too complicated, and no one can do it by themselves.
Adding to the complication, there are companies that specialize in reviewing medical cases and denying prior authorization. The biggest is called Evicor, which is owned by Cigna. Evicor employs hundreds of doctors and clinicians who review cases for major insurers and decide whether to authorize payment. Nonprofit newsroom ProPublica reports Evicor also uses an algorithm backed by artificial intelligence called the dial, which can be dialed up to increase denials. More denials save money for the insurers, which is why they use Evicor. Evicor contends its methods improve healthcare by denying unnecessary treatments that lower costs for everyone.
More savings, less complexity, better outcomes. That's the Evicor way, and we're putting it into practice every single day.
We have a big problem in healthcare across this country. We are by far the most expensive healthcare delivery per person of any country in the world, and our quality is not at the top.
Dr. Martin Lustig is a pediatrician and former insurance executive. He's also the author of Health Plans Unmasked, a guide to help doctors navigate the complicated health insurance system.
Most doctors who are out in practice are dealing with multiple insurers, and every insurer has their own set of rules, and the rules aren't the same across the insurers. So that's one of the big challenges for the providers that makes it so complicated.
Caitlin Donovan says health insurance companies deny claims for a variety of reasons, including lack of coverage, missing or incorrect documentation, or simply human error. She estimates almost half of insurance denials can be overturned in an appeal, but many people accept the denial and don't get treatment because they don't know how to file one.
If your insurance refuses to cover something that your doctor is prescribing, it could be because it needs the doctor to submit additional medical proof that that works.
And if you receive a denial letter for coverage, review it carefully. It should tell you about your next steps for appealing their decision. You can also ask your doctor for help. Have them resubmit the claim if it was denied due to an error, or ask them to write a letter that explains why the treatment is medically necessary. Covering your health, Mandy Rock, Fox 13 News.